The U.S. is well on its way to 200,000 new coronavirus cases a day. That's the opinion of one of the members of President-elect Joe Biden's COVID task force. Michael Osterholm spoke with Bloomberg's David Weston on how Americans should prepare.
Remember that at Labor Day, we were at about 23 to 24,000 cases reported each day. Now we're reporting over 130,000 cases a day, and we're well on our way to well over 200,000 cases a day. Our healthcare system's already overwhelmed in many locations in the country, and that is only going to continue to increase as these new numbers add up. And they are, in a sense, you might say, already in the pipeline if we don't have some immediate action for people to distance themselves from sharing air with other people, which I don't see happening. So we're going to have a serious crisis, much more than we've had already, just within the next, weeks to months.
And is it more serious than we've had already, in part because of the overall numbers that you describe, or is it also because it seems to be so widespread? I mean, going back to April, here in New York, we had a center of it, but a lot of the rest of the country wasn't affected. As I look at maps right now, for example, of positivity, boy, it's up almost across the entire country.
This is what we knew would eventually happen. I said back in March that we would not have blue and red states or blue and red counties. We'd have COVID-colored counties by the time this was over with. All we've ever tried to do is minimize the number of new cases and serious illness and deaths until we can get to a vaccine, which is still going to be well into next year. And so for the next 2.5 to 3 months, we're going to basically be seeing just what you said, cases all throughout the entire country, rural, urban, north and south, east and west. And that's the challenge of this pandemic, is now that it's hit a level where it is nationwide at the same time. And that means all the resources that we had available to us in the spring wave that you noted in April, or the summer wave that we had in July, that we could share healthcare workers in different locations of the country with other locations. Right now, we need everything everywhere. And so that's what's adding, in fact, to the challenge we have in responding to the pandemic.
So when you say, Doctor, that we may well be headed to 200,000 new cases a day, is that inevitable? Is there something we could do if we did it right now, understanding we're not doing it right now, but if we did, could we blunt that? Could we change that curve? Or are we headed there no matter what? And frankly, how much further up could it go?
Well, at this point, I don't see anything in the short term that's going to change that. If you look, pandemic fatigue has set in. We're seeing people who are basically going to bars and restaurants, weddings, funerals, having home celebrations, going to gymnasiums. I can go down the list. That's all happening. Then we have that group that I call pandemic anger. About a third of the population that still believes that this pandemic is a hoax and that therefore no public health action is really needed. And then you combine that with the increasing occurrence of indoor air exposures, meaning we're going indoors for the winter. And we know that the virus concentrations in rooms are much higher than it is when you're outdoors. You put that all together, that's already baked into what is going to be a severe challenge. In terms of getting us below 200,000 cases a day, that's not something I see that's going to happen immediately. But it will happen if people would just listen to what's happening. They see what's happening. And eventually, I think if enough cases occur in their own home families or their hometowns, they will see that. But that's a heck of a price to pay to get us to that point.
That was University of Minnesota Center for Disease and Infectious Disease Research and Policy Director Michael Osterholm. He was speaking with Bloomberg's David Weston.
The biggest stories the moment they happen from around the globe. Subscribe to Bloomberg Quick Take now for insight in an instant.